For our presentation, we will be discussing trauma-focused yoga, reviewing some of the research of its benefits, the modifications to traditional yoga, and providing a brief demonstration.
So one of the first questions that probably comes to mind when you think about trauma-focused yoga is, what is it? Well, in our research, we found a couple other names for it. It could also be considered trauma-sensitive or trauma-informed yoga. And there were several definitions that we found, but one definition that stood out was that it is a form of yoga that employs the central tenets of hatha yoga, focusing on physical movements, basic breath awareness, and guided restoration that are modified to foster choice, mastery, and a positive relationship to one's body. It's been shown that this can reduce autonomic sympathetic activation, muscle tension, and blood pressure. It improves the neuroendocrine and hormonal activity in the body, decreases physical symptoms and emotional stress, improves emotional regulation and relaxation, so kind of counteracting that decrease in physical symptoms and emotional stress. It increases self-reported quality of life, and it also improves mindfulness, self-awareness, and the relationship with the body for the people who practice it. When it comes to the research and benefits surrounding trauma-focused yoga, studies show that mindfulness interventions like yoga, as a supplement to treatment as usual of medications or psychotherapy, is effective in reducing trauma-related symptoms. People believe that the dual focus of yoga on mindfulness and being present and the mastery of body movement may also address that feeling where they lose control over their body and body movements. Increased interoceptive awareness may also be a mechanism producing the beneficial outcomes of yoga for those affected by trauma. So, interoceptive meaning being aware of and responsive to the stimuli that's produced within the body. So, for example, this would be getting something to eat when your stomach growls to let you know you're hungry, or going to the bathroom when you feel your bladder start to get full. Those are also ways of being aware of what's going on inside of your body. Evidence also supports that the use of yoga can heal the effects of trauma on the autonomic nervous system, and this may also be because of that dual focus, being able to check in with the body and the mind in the present moment. To go into a bit more detail with the benefits, the focused breathing is what helps improve the emotional regulation and sympathetic nervous system functioning. The meditative element of yoga helps reduce anxiety and depression and decreases that hyperarousal and intrusion, so the intrusive thoughts that might be coming into their heads. Moving with others helps build that interpersonal connection. The physical exercise improves those somatic symptoms that they're experiencing. And the safe and gentle environment cultivates compassionate awareness of your body and the environment around you.
So next we're going to talk about what makes trauma-focused yoga different from traditional yoga. So first and foremost, we want to look at the environment. You want to make sure that it is quiet, low noise, soft lighting, and then paying special attention to have minimal mirrors and minimal distractions to kind of reduce that stimuli going on in the room. Next, looking at the exercises. So yoga involves a lot of hip opener moves from child's pose, downward dog, 90-90 stretch, kind of those typical yoga moves that you would see in a traditional class. With trauma-focused yoga, we want to ease into those to make participants feel more comfortable, make sure that they're at a certain comfort level before moving into some of those. And then next we want to allow for plenty of modifications, so kind of providing some options of how they can perform the move at different levels, including looking at strength level and comfortability with those poses. We want to allow participants to keep their eyes open, sit or stand if it makes them more comfortable. The class is really geared towards them, making sure that they're comfortable the whole time and that we're not pushing them outside of that space where they feel safe. Next, looking at teacher qualities. So looking at these, you can kind of see some overlap with just the recommended qualities for counselors overall. So kind of applying those to a yoga setting. So being positive, welcoming, and non-judgmental. In the research that I came across, it also recommended not coming across as a trauma expert. So not saying things like, for some people who have experienced this type of trauma, this might be uncomfortable. Just kind of going about it as you would a traditional yoga class, and not specifically calling out their trauma and how this would benefit them. Next, provide modifications in a non-judgmental manner. Minimal movement around the room, again, to reduce that stimuli going on. Arrive before the participants and greet each one as they enter, just to make them feel welcome and comfortable around you. And then lastly, to speak at a slow and calming pace. In traditional yoga, you might see the instructor provide some type of assist. So verbal assist, telling the participant how they can modify the move or deepen the stretch, or physical assist, so physically guiding them into the stretch or modification. In trauma-focused yoga, it is recommended that you use verbal assist rather than physical touching. However, touch can be therapeutic, but should be used sparingly once trust is built. This is especially indicated in victims of trauma in which they endured some type of physical harm or violation of their body. The research indicates using invitatory language. So this type of language invites the participants to try it rather than telling them to do it. So you might hear a lot of phrasing like, if you feel comfortable, if you would like to move on to the next move, kind of providing them with that option to do it or not to do it, or to modify that move. And then overall, trauma-focused yoga provides participants with choices and community.
Next, we are going to show you a brief demonstration of trauma-focused yoga. You may participate if you're inclined to do so, and if you would feel more comfortable with your camera off to participate, that is also perfectly fine.
Hi there. So this is a short practice that we can call creating rhythms that gives us a chance to do something rhythmical, and you'll have an option to either match my pace or to go at your own pace. So here's the basic. We could try maybe one or two. How about two different movements? One possibility is to start here, and then one movement could be expanding and then drawing back in. So it's extending to your sides if you want, and then back to the center. So that's one you could try. You could try that a couple of times if you want to. The option is to add your breath to this movement. And one way to do that is to inhale as you expand, exhale as you draw back in. So it's inhaling and exhaling. So that's one possibility. Another possibility, a different gesture, could be something like this, like starting with your hands or fists and then inhaling, expanding, exhaling, drawing back in. Inhaling here, and then maybe exhaling here. So it's both of these are movements, and they give us a chance to experiment a little bit with rhythms. You can see that you can actually make up your own kind of movement if you want to. Anything that gives you a chance to maybe expand a little bit and then draw back in. Maybe attaching your breath to it, maybe just breathing separately, moving separately. So then here's the next option. First, you can kind of choose which of these gestures, and then if you want to, you can match my pace or you can go at your own. So I'll talk through my pace for 20 or 30 seconds, and then you can experiment with that or you can go at your own rhythm, your own pace.
Lastly, we wanted to provide you guys with some resources related to trauma-focused yoga. So first is the YouTube channel, The Trauma Conscious Yoga Method. This channel is run by a licensed professional counselor who is certified in trauma-focused yoga. She has a lot of great videos on what trauma-focused yoga is all about, as well as some classes and demonstrations on there. These two websites, the traumasensitiveyoga.com and traumaconsciousyoga.com, both have information on certifications, trainings, and events coming up related to trauma-focused yoga. It also has information on how to learn more about this practice and get more involved. The book, Overcoming Trauma Through Yoga, Reclaiming Your Body, is geared towards clinicians, yoga instructors, and survivors of trauma. So it kind of looks at trauma-focused yoga through those 3 different lenses and reviews the benefits and applications. And then lastly, this How Trauma-Informed Yoga Can Help Survivors Heal is an article that was recently published in Shape magazine, which is a popular fitness magazine. And I just wanted to put this on here to note that this practice is getting a lot more attention kind of in the fitness realm, and hopefully will be a bit more talked about.
And lastly, these are the references that we used for the research in our presentation.